Darren, certainly the reaction from many top medical personnel, welcome though this is, they're saying it's the staffing that is really the issue. All very well to announce extra ambulances, you need the paramedics to man them, and clearly retention is part of that staffing issue for the NHS.
It is indeed, Mark. I think there's no doubt, and the Prime Minister at one point I think said he will, hold his hand on his heart to say that the NHS is receiving more money than it has ever done in the past. It also has more people working for than it's ever done in its history. The problem is, of course, is the need, the demand on the National Health Service has also never been greater. And not least of all, you look at those problems, some of the big problems facing the National Health Service, and it comes from the fact that there is not enough people there for that demand. And the reason I say that in the end is because there's 1 in 10 job vacancies in the National Health Service that have not been filled. And many people like the King's Trust today pointing out, yes, lots of this investment is needed, the extra ambulances are needed, the extra beds are needed, but who's going to staff these beds? Because at the moment, there is a real problem with retention, there's a real problem with recruiting new staff, and additionally, Mark, we've also got a strike where lots of doctors and nurses are pretty unhappy and maybe continually will be unhappy. Morale is a big problem. In saying that, the Prime Minister and the government would say, well, we have got a plan, we are working towards it, it will work, it will bring down some of these waiting lists. And just to give you a sense of the goals they've set out, in March of 2024, so that's in just over a year's time, they said that they want 76% of A&E patients to be dealt with in 4 hours. Currently that's less than 70%, though the target is 95%. And also they want ambulance wait times in some of the most severe cases like heart attacks and strokes to be 30 minutes. Last month it was 90 minutes, but the target is 80 minutes. What I'm trying to explain here is even with the government's extra money, even with the talk about extra staff, even with the impetus of setting these targets, there is not a sense that the National Health Service is going to be returned or restored to pre-pandemic levels, at least within the next year. This is a project that is going to take years and years and years.
Of course, the other issue in terms of discharging people from hospital to free up those beds is, we've heard and time again from the NHS experts, it's about social care and addressing that and putting the money into social care to actually free up the system so they can move on from the hospital to social care.
Yeah, and there is a recognition, isn't there, that one of the big problems with the National Health Service is a lot of people who are in hospital can leave hospital. They just have got nowhere to go to because there are not the right facilities, either being serviced by the state or indeed that people could be looked after properly at home. Now, one of the solutions the government have come up with is this idea of virtual wards, which effectively means dealing with those people who could leave hospital either at home or in the community in a better sense. But again, you talk to the people on the ground who do this already, and they say that's all very well and good, but again, we do not have enough staff. And all this, of course, while Rishi Sunak also had asked questions about Nadhim Zahawi today. There are continued questions about Dominic Raab. There's a lot of politics around aside from all of this. And I know you're going to talk to Tom about Nadhim Zahawi, but it was interesting listening to the Prime Minister's main message from that, saying he acted pretty quickly. Lots of people would suggest he didn't, given the fact that he stood up in Parliament before he even launched that inquiry, stating that he felt all the answers had been provided by the former Chancellor on all of this. That clearly wasn't the case. And then you look at the opinion polls today, and again, this is where politically it's tricky, Mark, for the Conservative Party. A new poll literally from Ipsos out this morning, Labour on 51%. Up to the Conservatives on 26%. That is a 25-point lead. And Rishi Sunak's ratings are way down at -29. Keir Starmer is at -3. And when the question was asked, who do you think is most capable of being Prime Minister? Starmer now on 39%, Sunak on 33%. And, aside from trying to deal with this crisis in the NHS, the Prime Minister's having to deal with, let's be honest about this, a crisis within the Conservative Party and its ability to win that next election, because it looks very, very tricky indeed from where we stand right now.